pushing the wrong button. Even though it says push to speak, we were pushing right beside it. It just wasn't happening for us today. I am here to call us to order. This is the LFUCG Homelessness Prevention and Intervention Board and the Continuum of Care. This is our May 13th meeting at 1:30 p.m. here in the Phoenix building. Our first item is to have our roll call.
All right. Just a housekeeping reminder, the yellow button actually right on it where it says push to speak is where you push if you want to speak. We do use the audio for our minutes, so we appreciate board members. And then if any portions where we have public comment, if individuals would use that, it's very helpful. I'm going to go ahead and if you can just let me know if you are here. Joy Andrade.
Here.
Amy Beasley.
Yes, sir.
Amanda Bryant. Ron Delgado.
Here.
Diane Fleet.
Here.
TC Johnson. Billy Love. Chris Primo.
Here.
David Shad.
Here.
Liz Sheehan.
Here.
Lois Still.
Here.
All right, we do have a quorum.
Okay, our next item on our agenda is the approval of the minutes from our March 11th, 2026 meeting. Any suggestions or edits? Okay, seeing none, I'll take a motion to approve. We have a motion. I need a second. I'll second. We have a second from Chris, motion from Amy. Any discussion on the motion? Okay, all in favor say aye. This is a board vote.
Aye.
Any opposed? Okay, that motion passes. Our next item on our agenda is public and partner comments for issues on the agenda. Wave at us if you have one. Okay, seeing none, I will move then to our first committee report. This is for Data and Systems Integration Committee. I don't think Billy is here. Okay, we'll come back to that and maybe have to add that later. We will then move on to our Program Performance and Evaluation Committee report from Amy Beasley.
Thank you. We called our meeting to order at 1:35 on April the 15th. We had presentation from Bluegrass Navigators. Though they usually have folks stay with them between 10 and 14 days that are not sick enough to go in the hospital, but too sick to go back out on the streets. They run a hotel respite program, a National Institute for Medical Respite Care. Their referral processes for when their referral process for people when folks are out of medical respite, they're all inclusive. Then we had community action with their transitional housing. Their transitional housing works best because they tend to like to be with their friends for the 18 and olders. They're worried about grant money. We had one from New Vista. They have case management and peer support. They are increasing their landlord relationships, providing training so they are better equipped to do case management. They expanded to 22 families. They share the case management sheets with the for goals and plan. They will share the case management sheets for goals and planning. Then we had the Hope Center for 18 and older, night shelter. They do night shelter clothing, 3 meals a day. The shelter is over 30 years old. They are working on so hard to get the Hispanic population to come to shelter. And it seemed to be a trend through all of our partners is how to get them Hispanics to come in off the streets and into shelter because they're afraid. So they're working on more community engagement for the Hispanic population. Bluegrass Care Navigators told us about a home modification grant for 62 and older low income who rent or own. It doesn't matter if you rent your house or you own it. And there's some workshops on financial aid, paying rent, savings and checkings account. And then we adjourned our meeting. Thank you.
Thank you. Any questions or comments for Amy? Report. Okay, seeing none, I will move on to Advocacy Issues and Programs Committee report with David.
All right. Advocacy group met on April 22nd, Don Ball Campus Center. We reviewed and approved the February 25th minutes. On the agenda for new business, we talked about the Lexington Housing Flex Fund and made a motion to reopen and lift the cap on prevention funding that had previously been put in place to help mitigate how fast the money was getting spent. So there was $60,000 to $70,000 of this fiscal year's Housing Flex Fund remaining. So as I said, we agreed to lift the 30% cap on prevention funding to address some of the urgent needs, particularly given that community and resident services, we're expecting a funding gap that would last until July 1. And Arbor Youth and Community Action both confirmed that they do have the capacity to administer that. So that was voted on and approved. We discussed coordination and resource blending across agencies. This sort of stemmed from discussion on the Flex Fund and just housing resources in general, talking about strategizing about ways to share information between providers to reduce the duplication of effort, to just try to provide better coordination of resources. Let's see. So we also gave an update on the mayor's task force and what was going on there. So preview for those, preview for those of you staying later. The task force is essentially prioritizing some particular groups, including families, seniors, disabled populations, looking at integrating services for pet accommodations, and also addressing issues like mental health and addiction. The task force group talked about has discussed a proposal for a central triage or navigation center that would take referrals, people coming into the center. Talked about potential locations for that. I do think I skipped a page. Talked about potential locations for that being one of them being the Versailles Road campus that the winter shelter was located. Let's see here. I misstapled. So we discussed the need for some site flexibility, the idea of having more modular units whenever that is designed to allow shifting between populations. For example, if you had a larger family, you could adjust to accommodate that. If you didn't have families, you could adjust that to meet the needs of more singles or smaller couples. So just being more flexible in terms of the layout of that as we get into the planning stages. We discussed some of the shelter staffing issues in the existing shelters, particularly related to some of the barriers that they see related to caseload size, dealing with mental health, co-occurring disorders, and how understaffing leads to a lot of people being restricted from the shelter system just because of the burden on the existing staff and how many people are in the facilities. So we had discussed the idea related to providing more intensive case management to clients in existing shelters, and also the notion that that case management can function independently of the shelter. So it could be an outside agency who is doing the case management. Talked about landlord engagement and housing market challenges. So as you know, it's hard to rent now. So discussed some of the barriers that are going on now in terms of our ability to house clients, being reluctance to accept vouchers, um, outpacing the rental prices, outpacing fair market, and the need to continue to develop relationships with landlords. So discuss some upcoming meetings to help inform landlords about services, and try to engage them. Discuss the need for more affordable units, rentals that are within voucher limits, especially for larger units and multi-generational or blended families. Talked about the supply of 3+ bedroom units being very limited. So all of those being challenges. Figure out where I did this. Okay. We also talked about the upcoming HUD COC NOFA, and the expectation was, you can stop me if there are changes here. I will not give. Okay. I don't want to give old information. It changes all the time. So there was an expectation that a NOFA would be released in June with key changes, including a higher Tier 1 renewal cap of 60%, increased emphasis on transitional housing and supportive services, and new requirements such as limiting rental assistance duration and imposing work requirements. So I think that all seems like potentially on the horizon as we start to see a NOFA release. Also, there was discussion about potential board changes, adding business representatives and law enforcement members, which seems to be part of some of the HUD requirements. I think that's about it. Anything you want to add to that?
No, and we'll actually, as part of the director's report, we'll have additional updates on the continuum of care NOFO. But you're correct. We did get an email about a week or two ago that confirmed that we are expecting a NOFO by June 1st.
So it'll be here in August. So in terms of old business, we talked about an update to the 1915 IRIS initiative. That rollout has been slower and more complex than expected. Limited case management providers statewide, and the state sort of requiring full coverage in a region before they start referring clients. So just a little discussion on that program. Nothing really new there. And the shelter standards meeting will occur on May 22nd at 2 p.m. to look at current shelter standards and any changes that needed to be made there. Let's see. Is that May 22nd or May 27th? I wrote both, so somebody will tell us. The next meeting is June 24th, again at the Don Ball campus.
Emergency shelter standards are May 27th. So in 2 weeks.
We'll have do you have any questions for David for his committee or comments? Thank you. We will turn it over to Marissa for the data and systems integration committee report.
Thank you. The DSI committee met on April 1st. We approved the meeting minutes from February 4th, 2026. Jeff Herron provided an update for HMIS reporting requirements for the Extended Social Resource, ESR. And we spent a majority of our time talking about the point in time count and housing inventory count. At this time, at the time of our meeting, we had just received a notification that the PIT and HIC will be provided or need to be provided to HUD by April 30th. That deadline has since passed, and we did submit to HUD. So we were able to submit our point in time count data as well as our housing inventory count data. We also spent a majority of the time with a presentation regarding the fiscal year 2025 system performance measures. We were able to submit those SPMs to HUD as well. We dove deep into exactly what those performance measures were telling us about our system, including ways that we have improved and ways that we have, just as the system stagnated, thinking about things like income. However, in comparison with other COCs, similar to years past and similar to how we have performed in years past as well. We also received updates just from HUD generally, specifically regarding the sex data element that is now in effect. That means that all HMIS organizations, participating organizations, will need to be collecting sex rather than the field of gender. We also received some housing triage updates from myself, specifically talking about following up in a precursor to our COC discussion, just about the needs for a diversity of resources, specifically with housing triage, because of the potential limitations of permanent housing that we may see with this specific funding source. And because of those limitations, the limited number of referrals that we had as a part of Q1, I should say, of this year, calendar year. We also had HMIS trainings and announcements. We've had a couple of new user trainings for HMIS. Registration is required, so you will need to reach out to the HMIS data analyst, Adam Kuhn, for registration. And we also had an end user group that occurred yesterday, specifically around the 2026 security training requirements for HMIS. So if you or your organization is HMIS participating organization and you are not in attendance, you will still need to review those materials. Make sure that you are watching that recording and completing the necessary documents. That is annual and it is required of all organizations, even if you've been an HMIS participating organization from the very beginning. Our next meeting is June 3rd, 2026 at 1:30 at the Marks Ferry Family Branch off of Versailles Road. That is all that we have.
Okay, any questions or comments for Marissa for that committee report? Okay, seeing none, I'm going to turn it over to Steve Hafer for our encampment SOPs and review report.
Alrighty, so this period we had 11 camps that we cleaned up, which was quite a large number. Most of them were not very big. Kind of two I want to go over is the one on Elkhorn Road, which cleaned up the creek from Winchester Road to basically I-75. It's 0.4 of a mile long. It's about 2.5 acres that they covered in that camp cleanup. So it's $24,000, but it's a lot. There's a lot of trash back there from old camps, not necessarily existing ones, and then a lot of brush that was cut and removed. So you can clearly see down through there now. That area has been an issue for us, for police, for some time. So we're hoping that that kind of takes care of that area with that. We've also recently had 2 or 3 individuals either housed or placed, and a couple more that we're working with out there to get them placed. So I think that will help a lot with that whole area out there. So that's helped a lot. And then the Bel Air, the end of Bel Air and where the Legacy Trail comes into it, we had some neighbors, a couple businesses down there complaining about homeless generally just hanging out. They were not really camps in their traditional sense, that they were not sleeping there all the time. They were more kind of covered up so they could get out of the sun and kind of rough sleep or sleep there during the day. Partnered with code enforcement, went down there and totally clear cut the end of Bel Air Avenue and opened it up, and then went over towards the Legacy Trail and cut down some honeysuckle and picked up trash over there to kind of daylight the area up. At the same time, RJ Corman came in and they cleared up the tracks from Bel Air over to Price and had that all cut out and all the trash removed. So since then, we've not had any complaints at all over there. We've just found when they daylight the area up and don't have them someplace that they can go hide or get out of the sun, they're going to go someplace else. So those are the two big ones. If anybody's got any questions about any of the individual camps, I'm more than happy to answer them.
I don't have a question, but I do appreciate the detailed reports with the pictures and everything. I think the pictures really help us understand what this is and what it looks like and what the cleanups look like after. So I appreciate that.
That's something I started because in the past, it would have been one night thing about it, but Jeff really didn't have access to the pictures, and I'm out there now, and I've got, and I'm taking the pictures and have access to them. Working with Adam and Marissa too, we're going to come up with some different ways to kind of report some of this stuff out. It's always kind of been reported that one of these locations is one camp, and they're not necessarily one camp. There can be 5 or 6 camps at one location. So we're going to try to break that down to kind of give it some more kind of overall on, like you spend $10,000 at one location. Well, yeah, we did, but it was like 5 different separate camps there. So it'll break it down more to kind of like what the camps are costing versus kind of just a location. So
I think that would be helpful.
yeah, we want to start collecting that data and hopefully start reporting it out here soon.
This is a little bit of a different angle that I'm coming at, but there's something that's kind of sad of the fact that people don't have a place to go to during the day and they're looking for shelter in some shade spaces. So I just hope this committee continues to remember that as much as people don't have a place to go, and we know from the homeless task force that there's not enough beds for everybody to be in, and not everybody wants to be in shelter, that it is a real hardship for people in the middle of the day, particularly when we start getting into summer. You need some shade spaces, so I appreciate, I go by that Winchester Road area a lot. And I know there's a lot of, just hanging out. And I kind of get that a little bit. So I'm not saying it's not a good thing, but it just shows the need for other spaces for people to be able to safely congregate and kind of hang out and get out of the weather and all those pieces. So good for you for adding more sun to it, but then I worry.
Yeah, no, it's kind of a double-edged sword. It'd be nice if they did have some place where we could go to. So they literally burned the fence on one of the properties down there in 2 different locations, and one of them, it took out about 20 feet of the fence. So there needs to be a good place for them to go. Hanging out at the end of the street is not good for anybody.
How many people do you think at a given time usually are in that little creek area of Winchester Road? Like, I know you said this was probably lots of camps throughout a period of time, but at any one given, how many people do you think tend to sort of hang in that space? Do you have a clue?
So to me, there's kind of 2 different categories of them. There's the ones that fly the signs out there that truly I don't know where they're at in camps.
Yeah.
And then the ones that were actually in camps. So the ones that are flying signs at any given time, there's 3, 4, 5 of them out there flying signs.
Okay.
The ones in the camps, maybe a couple.
Okay.
And we've gotten a bunch of that cleared up here literally in the past couple of weeks.
Yeah.
We've gotten some of them placed.
Good.
So yeah. So it's
And most of the folks that are in a true encampment out there, it's been kind of repeat issues for a lengthy period of time. The 2 successes that we had last week, there was one gentleman that has established multiple different camps. I would say at least 4 or 5 different locations in that area, and traditionally hasn't really engaged homeless service provider. Working with the neighborhood resource officers in the sector, we were able to facilitate contact with New Beginnings. They confirmed SMI status, also co-occurring disorder, individual had expressed some substance use, and then working together with Recovery Cafe, they got that individual resumed with insurance and into a residential treatment program, and Beginnings Housing Navigator is going to help them with permanent housing on the tail end of that. The other success is an individual that several of our organizations have worked with, who's been in a couple of our winter shelter programs, has a permanent or long-time restriction from shelter. Same thing, working with neighborhood resource officers, Steve, New Beginnings, Hope Center Street Outreach. We were able to get him placement on an income-based property in Winchester, and Outreach transported him last week. And we have another we're working on to get into a residential treatment program on Friday of this week. So really those long time, like true encampment, not rough sleeping, not panhandling, It's usually a limited number, maybe 1 or 2 active camps at a time generally.
Any other questions or comments? Diane, I think that your point is well taken of, okay, well, if people are moving on from a space because we're cleaning it up, like where do they go? And, you know, our board and the continuum of care has been able to use some funding to provide like shade structures at some of our day centers. So like, I think that is something we can keep in mind and have those thoughts while we are determining how to, where and how to spend our funding. So, yeah. The next item on our agenda is our director's report. And we have several things there, so I'm going to turn it over to Jeff.
Thank you. We'll start with the budget report. This is getting a little bit quicker now that we are no longer reporting on multiple years of ARPA funding, which we fully expended. So we'll start with fiscal year 25 funding. Anytime that you see an unallocated balance remaining on this year, it's already been moved forward through a budget amendment to the current year, but really just for the purposes of helping us visually understand funding as separate years, just showing you what was actually funded with originally fiscal year 25 dollars. Most of these projects have essentially closed out. We have a second year for the landlord partnership program with Lexington Housing Authority. That was not an automatic renewal. They're still spending on their first year term, which was extended. So as a board, we'll revisit if we want to move forward with funding that. Then we had some of our funding for winter to supplement funding to Community Action Council for winter family shelter. That's been fully processed with a small remainder. We also had the RFP that providers could apply for program funding to meet gaps. We have White House having fully expended their award. Touch base with a couple of the other programs, Greenhouse 17, Community Action Council, and Arbor Youth. They are spending those funds, but we're likely going to need to extend that. So we're going to be working on getting those agreements updated with council, kind of just with slow implementation for new programs. Some of these might have involved things like having to hire new staff. And so we just need to give them a little bit more time because actual operations weren't 12 months after they finally were at a point of getting started. And then additionally, we had the Housing Flex Fund. We've had some additional expenditure on these programs with winter shelter. And as we came out of winter shelter, David reported again that we had resumed the fund and also lifted the prevention cap so that if there was a gap in funding for community and resident services with emergency financial assistance, there was still a source that people could pursue prevention funds through. And that is an automatic renewal, which you'll see on the next fiscal year. So we ended up with about $147,000 that was not spent in fiscal year 25, and that was carried forward. Fiscal year 26, we still have several programs that are just starting or yet to begin spending their funds. Street Outreach is on its third term. We'll be rebidding street outreach services probably within the next, I would say, 1 or so months. So you will definitely see RFP go out for that. We will communicate that through our listserv and then bring applications back to our Program Performance and Evaluation Committee to make a determination on who will carry those services forward. We have 1 year remaining with Center for Accessible Living for their intensive case management program for persons with disabilities. Again, we had originally written the landlord partnership program to have 2 additional terms optional. Right now, I'm going to guess that we may look at repurposing that 3rd year since they're still on 1st year funding, and we would have lots of time to work on funding them for any additional terms. We have automatic renewals that went into place for Arbor Youth and Community Action Council for a 2nd term on the Housing Flex Fund. That just started, so we have not yet seen those expenditures hit. We had voted to go ahead and dedicate $40,000 for winter financial assistance. So one item that I will end up needing a motion for, when I ran these financials, we had just a little over that 40,000 with 44,658. That was deposit and first month's rent to move households into permanent housing who were at winter shelter resources so that they were not displaced. Don't have the numbers right in front of me, but I believe it was going to be right around 30 or so households that we moved in. You'll get some additional information about who moved to permanent housing when we discuss the winter shelter outcomes. We had also voted to give some emergency repair funding to Greenhouse 17 to fix their fire sprinkler system, which had been at the end of its life and threatened to take a significant number of beds offline. They have now completed that project and sent us all the expenses for it. And then we had voted to commit additional funds to help with winter response beyond what was established in the general fund for the winter warming shelter. We actually ended up allocating that in the form of funding for Bluegrass Care Navigators winter shelter program for elderly and disabled individuals, and to Community Action Council for their winter family shelter and expansion of their emergency family housing program. We will also need to vote on approving additional funds for Community Action Council. We saw an increased need this winter. We also saw larger families and longer length of stay. Again, I'll give additional information about that, but they are requesting $177,500 in additional funding. That would bring them up to a total of, I believe, $355,000, and that would cover all projected expenses which are currently being processed. So for fiscal year 26, factoring in all funds that have been carried forward from previous fiscal years, we're going to be just under $700,000 in unallocated funding. And then even though it's not board controlled funds, just for the sake of transparency, I did include the winter shelter funding that came to us via the general fund. We are waiting to process the last round of invoices from Emergency Disaster Services. And we had overall pretty low fuel costs that only ran $5,000 beyond the base contract, given the extreme weather that we had and then the pricing of fuel. Very, very satisfied to see such a low number there. And then for our strategic plan, we are currently pausing to see what the recommendations for the mayor's task force are going to be so that we can make sure to align our strategic plan with those recommendations. Any questions regarding the budget? I think that sounds like Diane Willoughby, their finance person. She always wants to make sure she's within the rules, so she's going to come back 1 cent under. And then with this, I will go ahead and give the winter weather response debrief before asking the board to vote on those 2 winter-related items so that they have full context. Next slide. So just as overview, we have continued to operate for, I believe, now the 3rd year in a row in a season-long approach. We first did that with the temporary shelter on Loudon Avenue in the 22-23 winter, actually 23-24. And that was a major shift for our system. Previously, before that, we had very limited additional resources over the winter season. Generally, that was going to be targeted to populations only, like families with minor children. And then for adults, usually we would have a limited amount of hotel funding, and we would only be able to provide that to individuals when we had conditions where the weather dropped below 32 degrees. As we know, there can be weather conditions that are harmful for individuals that are unsheltered, even when we don't have temperatures below freezing. And so that's part of this shift to a season-long approach. Additionally, it gives a little bit more stability for individuals and greater opportunities for service providers to engage towards more permanent solutions. At this point, we generally have at least 3 seasonal resources. The primary, serving adult men and women, would be the LFUCG Winter Shelter. This year, that was a site-based temporary shelter. We had structure rentals and daily operations from Emergency Disaster Services, a local company that does disaster relief across the country. And they provided us with a design that accommodated 216 persons nightly. And they relied primarily on supportive services coming from partner organizations. The kind of trade-off here was we had a dedicated shelter operator that was not one of our existing homeless service providers, kind of expanding the capacity for our community organizations to really do more in helping with the case management aspect instead of having to take on the burdensome operations of a large-scale shelter that also involves things like temporary staffing. In addition to that, we generally provide additional funding to Community Action Council to facilitate hotel stays and case management for families. And this is an extension of their emergency family housing program. And then knowing that the temporary shelter involves things like trailers for things like restrooms, that might involve, a couple of steps that someone has to be able to navigate. We do see some mobility needs and physical limitations that aren't ideal for that environment. So we provide funding to Bluegrass Care Navigators for a program that targets persons that are elderly, that would also have significant disabilities, where they're not able to access traditional shelter. This year, that program was funded for 11 rooms nightly. Thank you. So going into greater detail on the individual resources, the first is going to be the winter shelter on Versailles Road. Included in the packet is also going to be a 3-page document that gives some information about things like demographics and outcomes. Some of that will also be touched on here, just not as robust on things like demographics. So this was a project that included 2 agreements, one for structure rental and installation and one for operations. The overall cost being $2.4 million. For that, we had a staff that was responsible for the building and takedown of structures and the rental of those structures. And then on a daily basis, they provided us with data intake and entry into our HMIS system on residents accessing the shelter, daily meals, on-site medical services, 24/7 security, and again, just daily operations. This year, we served a total of 877 unique persons. That was about 164 persons a night on average. Keep in mind that since we're running from November 1st, for this shelter, we actually opened on November 15th due to electrical issues that delayed us, all the way to April 1st, we do see fluctuations. So during extreme periods, there were a couple of times that we did have 216 persons in shelter and we're at capacity. But then looking at some of the periods of time throughout the winter that maybe were a little bit warmer, we're in Kentucky, we get some of those summer moments in the middle of winter. We would obviously see a little bit less persons accessing shelter on those evenings. In general, average length of stay was about 24 days. That can vary. We had some individuals that might have stayed with us for a very short amount of time, some persons that were there the majority of the season, and we're going to talk about how that compares to previous years. So I thought it was helpful to provide some context that helps us understand the different models and approaches that we've taken the past 3 seasons and kind of how that translated into outcomes. So the greatest number of persons that we were able to assist was in the 23-24 winter. That was the Hope Village operated on Loudon by Hope Center. We had just over 1,000 individuals that were served there unique. We saw that we served the majority of persons that were coming from a literal homeless situation, but we also might have folks coming to us from institutional stays like jail or hospital, even some situations like renters who maybe had issues with their home, lack of utilities, or maybe some kind of code issue that sought that shelter out as an alternative to staying in conditions which might have been subpar. This was also the shelter that tended to have the shortest length of stay for individuals accessing the resource, with an average stay of about 5 days. It's a little bit misleading in the sense that what we see for individuals with that shelter is they tended to access frequently, but for short periods of time. Again, also oftentimes weather related. That year, we also had supportive service providers trying to engage individuals on site. We had about 5% successful exits, and that translates into 49 persons. So it seems like a relatively small number, but again, factoring in that the average length of stay was only 5 days, it's still significant movement towards permanent housing for those 49 individuals. The following year, we were forced to return to a hotel model, not being able to identify a site and operator for the site-based model. That greatly reduces the number of persons that we are able to serve. We had a fixed number of rooms that were available to us each night, and it's difficult to be able to place individuals on an emergency basis if you don't have overflow available. So these were more continuous stays with an average length of stay of 63 days. And we did have an increase in the number of positive exits. About 19% of individuals, or 61 persons, moved to positive destinations by the end of the season. There is still some challenges with this model. We did find that sometimes we had more difficulty engaging individuals in service because there was not dedicated service space at the hotel, and sometimes people did not necessarily invite us in or weren't present for us to be able to engage. Also, with the hotel model, we have a little bit more, we have a little bit less control over things like determinations of who is able to remain if there's an issue, with some of that control sitting with the property owner. This year, we returned to a site-based model, and as a result, did see a much higher number of persons access the resource. We had 877 unique individuals served this season, and it's kind of a mix in terms. We had some long-term stayers, and then those that also access more intermittently. Overall, average length of stay being 24 days. We had 11% positive exits this year, but putting that into context, it's 94 persons that exited. So even though it's a smaller percentage, it's actually a higher number of persons that ended the season with access to permanent housing or a resource such as residential treatment that was needed for their situation. Right. So with all this information, we've reviewed our data, but also conducted debriefing meetings. We have met with internal parties like our facilities team, our police, our first responders, paramedicine, as well as external partners like those that delivered supportive services to our residents to really help us understand what worked well and what did not. I just wanted to share a few notes with you all. So as I mentioned before, we do sometimes encounter some challenges with a hotel-based model, and we largely see service providers continuing to prefer a site-based approach, which makes it easier to engage individuals and to quickly facilitate access for those that are in need. We've also identified that if we utilize a space where we have a larger footprint, we could potentially do something where we could modify design where some of those individuals that have some level of mobility issues may still be able to successfully navigate if we were able to install some things like ramps instead of steps into those trailers. In the past, we've been kind of limited in trying to stick to a certain portion of a property, and that just doesn't leave a lot of space to introduce some of those more accessible elements. And we did see that at times during the season, Bluegrass Care navigators had to operate overflow. So this is something where if we can improve what can be handled on site with the temporary shelter, we can also reduce the burden on a resource like Bluegrass Care Navigators and their specialized program. Emergency responders also gave a lot of positive feedback about having easier access on this site. If you recall, on Loudon Avenue, we actually were on a grass portion of YMCA's property, which meant we had to lay down gravel to try to level the site. And that just made a lot of challenges, especially also not having a lot of direct access to a driveway or a roadway that went all the way into the shelter. We had to be very close to the Legacy Trail, and it was just impossible for a stretcher to be kind of wheeled across that environment. It also significantly limited the individuals with mobility issues who were able to navigate that successfully, even if it was something like a walker, which might be capable of navigating the temporary shelter when it's on concrete or level ground. We also got a lot of feedback around a significant reduction in the number of ambulance runs. This was facilitated by EDS incorporating on-site medical services for the shelter. This meant that we could handle anything from providing over-the-counter medications, wound care, first aid, vital checks, and we were really able to defer a lot of needs that might have been an ambulance run in the past if it could be handled by a lower level intervention. About halfway through the season, we also started a pilot street medicine program with Health First Bluegrass. And they were able to see a significant number of persons on site, providing everything from basic visits to prenatal care to on-site labs or pharmacy delivery services. So those resources combined had a significant impact in reducing ambulance runs. Finally, as we continue to think about site design in the future, we've traditionally not had enough space to have just dedicated offices or private rooms. We've had to use spaces that have dual purpose, like our dining hall. And so that does put some limitations on when we can access those spaces and how private that they might be. So we're hoping to be able to establish some additional private spaces in the future. So if, for example, a provider like New Beginnings wants to do a psychological assessment with somebody to determine if they meet state criteria for serious mental illness, they can have that conversation in a dedicated space where someone might feel more comfortable to disclose sensitive information. All right, moving on to Community Action Council and their winter shelter program. We originally funded this at $177,250 with a projection of serving 45 families for up to 30 nights each. Our actual expenses right now are projected at $355,000 for this project, so roughly double. The reasons for this, we served 215 persons and 52 households this year. To put that into perspective, last year we served only 41 households and 148 persons. I mentioned previously that we saw a lot of larger families this year, so we have a number of families that require 2 rooms nightly because they might have had something like 8 family members. And additionally, when we have some of those larger families, it's also a little bit more challenging to quickly connect them with permanent housing if they have limited income. As I think David mentioned earlier, there's a limited number of larger units that are available in the community. And then especially if people don't have access to something like rental assistance or a voucher, it can make it really difficult for families to be able to access and maintain housing on their own. So we did see an average length of stay that lengthened from the previous year. Households on average stayed in this program 52 days this year as compared with 43 days last year. I don't think I have to tell any of the providers in this room the difficulties with our rental market and the challenges in finding things that are available, affordable, and willing to work with programs or our population. So that continues to be a need that we see in terms of just needing a higher level of landlord participation in our programs. Finally, I always like to highlight the outcomes of all of these programs, but I love sharing the outcomes of this program in particular. I want to give definitely props to Marty and in particular Francia Gonzalez, the case manager that's been with that program for several years now. Francia is a permanent housing wizard. She housed 22 families, 86 persons of those served. 42% went to permanent housing. That's 41% of all persons served. And of those 22 households, 15% of them exited to permanent housing with an ongoing subsidy. So that increases their ability to remain housed long term. It's truly remarkable to be able to move that many people not only to permanent housing but to sustainable subsidized housing in such a short length of time. So we really appreciate that hard work. Kind of notes that I would give about this. We continue to see this need increase year over year. We're having to put more funding into family shelter each year because of the limitations on the number of units that we have year round. Another point which helps contextualize this is looking at the results of our 2026 LEX count. Again, mentioning the larger number of families, you see here that we actually had 18% decrease in the number of family households, at the same time having a 10% increase in the number of persons within those households. So we are seeing fewer households, but they're just much larger in size generally, which makes it a lot more challenging to operate when we are trying to do something like ask the Salvation Army to take somebody into an overflow space. If they don't have a dedicated family unit, that means that we're trying to house people, shelter them in common spaces like a TV room or a lobby. And it's just really challenging to do that with a larger family, especially with small kids. And likewise, even on this hotel-based model, there's challenges. I mentioned having to potentially rent more than one room for a household each night. That's really just not the most cost-effective solution for us long-term. And so I raised this point to make sure that the board and the task force are considering this and our need for additional family resources. Kind of like David said, things like a modular design of a space would really help us to serve those families, serve them with dignity and stability, but also do it in a way that's more practical for us long term and doesn't involve overcrowding individuals into overflow or having to spend large amounts of money on hotel spaces. Last and not least is our medical respite winter program with Bluegrass Care Navigators. This was budgeted at $203,907. They did have some overflow beyond the 11 rooms they operated nightly. We were able to right size that budget by charging those overflow needs largely to the base medical respite program funded with extended social resource dollars. So they did not need to ask for an increased amount. But they too also saw increased need over this year for individuals with significant disabilities or mobility limits. And we prioritize those that would also be of a senior age. This year, we served 40 persons in 37 households compared to 35 persons in 27 households last year. So we had more persons this year that might have been singles, but we definitely saw more households overall. Slight increase in the length of average stay for participants, going up to 52 days this year from 48 days last year. And they had almost a third, 29% of persons exiting to permanent housing. With this program, I would note that we continue again to see a growing level of need. We have a population that we also see aging. For context, the 2026 LEX count, we had 10% of our overall persons in the count identified as those who are 65 plus. And that's the population that we're seeing kind of currently the highest level of growth, the highest rate of growth. That's definitely one factor here. But we also have a population that traditionally lacks access to healthcare, sometimes health insurance. So we're going to see a lot of routine needs for health that are deferred. We know that our population tends to, on average, have a shorter lifespan if they're experiencing homelessness, and even routine conditions can result in long-term issues. To give a little bit more context around this, with those that were presenting at the winter shelter, we had several that maybe we wouldn't have traditionally considered meeting this level of need, but they still had some challenge in navigating that temporary shelter. And a lot of that's going to be that we just have so many persons that we're seeing present with disabilities. 77% of all residents at the winter shelter self-reported one or more disabilities, 28% of those self-identifying a physical disability. And just as I mentioned, kind of the age shift that we've seen in the Lex count, we served 25.6% of residents at Winter Shelter who were age 55 and older. I can share that from another recent meeting, Hope Center on an annual basis is now seeing a similar level of about 25% of persons that they serve annually being 55 plus. So this, again, underscores the need for us to have additional resources dedicated to those who are elderly and that have significant disabilities that might make it difficult or impossible for them to access our existing shelters. Before we would vote on winter-related, I just want to offer an opportunity for any questions or discussion around the debrief.
Just had a question on the two of the models. So going back to the 23-24 model versus the 26 model, the two non-hotel programs. The hotel is obviously in the anomaly. It was a totally different model. Looking at average length of stay, you go 5 days versus 24, and they were substantially similar in terms of the model. I know David wasn't just kicking people out over there left and right. So what thoughts do we have on what might explain that difference in the average length of stay?
I think one of the things is a lot of people presented to the winter shelter that were able to move into the other shelter.
And so you just move them in those cases?
Yeah, so I think in not necessarily at the beginning of the season, but as the season went on and the numbers were higher at the temporary shelter, we kind of put a policy in place that if you can stay at the main shelter, you needed to do that, just, you know, because of the availability of beds. So we shifted some people over there. So I think that probably contributed. There were a whole lot of people who were there for very brief times and then just popped up a couple of times during the season. So I don't know if that number is like 5 days at a time or if it's 5 days across the season. But we did see a lot of people who would come in just during cold spells. So I think that also.
So to that point, the way that ours is going to run that information, it's going to look at the average stay. And so it wouldn't be a cumulative number for persons that had multiple visits. And that goes for all of those length of stay figures. Another factor that I would point out is the weather. We did have some extreme cold with the Hope Village that we did in 23-24. But I think this year, the ice storm that we had a more significant impact in people being able to get around town. I feel like there were several weeks where we had providers that were still kind of operating with limited staffing just because of the difficulty of people being able to safely navigate the roads. And I think that's even greater compounded for someone who's traveling on foot.
I think also the location of the winter shelter was further out. So I know from my client's perspective, a lot of them, once they got out that far on Rochelle Road, they weren't coming back. Like they were just there.
That's a really good point. It makes sense regarding the difference. And then I would just add, I think it's a positive the increase in the percentage of positive exits. I realize it was a smaller base number, but at the same time, I suspect that it reflects you getting better at that. I know last 23, 24, you and I were kind of scrambling at the end and piecing some things together funding wise, whereas we planned ahead a little bit more in 5, 6. So I think you'll probably even see that go higher in 26, 27 if we just get a little better in the year.
I definitely have learned way more than I thought I ever would about buildings and about operating seasonal programs.
I was looking at the sheet that is in the packet on page 31-ish. That's the handouts that you provided us with some of the data. And looking at the prior living situation, most people, 347 reported coming to the winter shelter from a place not meant for human habitation, but then quite a few people came from another emergency shelter. So do you have a sense of why they would leave that location to come to this location?
So 2 things that I think factor in there. One is restrictions. Another is going to be our population tended to want to check this resource out. And I think sometimes the new resource often sees a initial surge in demand. There might have been things that maybe people liked about the space that they preferred to one of the existing shelters. I know that when we went on our tour, when our existing shelters get really full, we have things like people that are sleeping on mats and cots and hallways and shared spaces. And so I think being able to access a bed is always going to be preferential to that. And then I think another thing that might have facilitated that just left my brain, and I will let you know if I remember it. But in general, I think we see that when we do a site-based model, we are truly meeting more of the emergent need for people that have limited options versus a hotel-based model where we have a lot more screening to do to weed out individuals who might have more marginal housing that just have a preference for a hotel stay versus some other situation that they might be in. So those are at least a couple of factors. And I think too, what I was going to say earlier that now came back to me is I think some of our year-round shelters, when they noticed that their capacity was starting to get to a level where we were going to be in overflow, they were sending folks over to the temporary shelter to try to keep it at more sustainable levels.
Thank you.
What was the capacity rates in both of these models? I thought I had seen it in a slide, but now I can't find it.
I know for sure we had 216 beds this year. With the Hope Village, I believe we started with 140. I would have to look that up to verify. And I know we did when we hit the extreme weather in January of that year, we did get bunk beds to increase the numbers. And that would have put us closer to like 180 bed capacity.
There were a couple of situations where we drifted over 200 during that, but I think our real capacity was closer.
Yeah, I think there was one period in January or so of that year that we converted the dining hall to another housing structure. Since Hope Center had the Jacobs cafeteria on site, we could have people go down to the Jacobs cafeteria for their meals instead of being right there on the YMCA's campus. But that was definitely not ideal because it took away the ability for them to get meals right at the winter shelter, but also whenever we would use that as a service space, it was not available when people were residing in that structure.
Yeah, I see it here. It looks like it was 76.1% utilization. Like 76% of the beds were used on any given night. Okay.
It sounds like whatever model we decide to do for next year, the on-site medical seemed to be a really, really critical piece. So if you still go back to the same group or not, that just seemed like a bit of a game changer for our emergency response pieces. also the location to have it on flat space. I remember you all talking about not being able to
Yeah.
get stretchers and stuff, but that just seemed really a really important piece. I didn't hear the complaints about food this time either, but that might be, I was connected more to the hotel stay folks, so I might have heard that more, but that seemed, the whole package this year seemed to be better, but the medical was really important.
Yeah, with the medical, I learned that we even had someone from our fire department who, as a second gig, had been doing a little bit of work over at the shelter, and there was a lot of good collaboration that was formed between that medical staff and entities like our paramedicine team and our hospitals. I think we were able to do a little bit better job at screening potential hospital discharges and making sure that they were appropriate for this resource, and diverting things away from hospitals to begin with.
I just wanted to, like, I guess, make a comment on something I kind of noticed, and you touched on it, but it's real interesting to see the relationship between length of stay, size, like, of the number of people served, and then the percentage of positive exits, even across different program types, even with subpopulations. Like, I wonder if there's a way for us to kind of look at the data with the mindset of what amount of essentially like case management services would be needed to get similar positive exit percentages out of an on-site or site-based shelter, you know, so that it's kind of in line with something like the Family Shelter Project or Bluegrass Care Navigators Medical Respite, because both of those had really high percentages. And of course, 10% is not or 11% is not a low percentage for something like this, but like, how many more people would it have taken to get us there versus the cost to the system? And you may have already looked at that, but that's like a question I kind of have looking at it.
Yeah, we also, we this year relied on volunteer commitments from our service providers, and just as much as I think things like the weather facilitated longer stays for some of our residents, it also really impacted our ability to deliver services. We had basically the last couple weeks of December lost to the holidays. And then once we went into January and we had that weather event happen, that was really about 4 weeks or so that we had limited numbers of organizations that could participate in that kind of an effort. Once we got out of that weather event and we had weekly service events there, I think it definitely helped. I will say that having been out there so frequently with those events, we also did just see a decline in the number of people that were attending those events and actually engaging with individuals that were trying to offer services. So some of this too is not just what resources does it take to get the right level of case managers, but how do we better get people to engage us routinely, so that they do move towards a better outcome.
Yeah, I was going to say along those lines, I think 24, 25, one of the big differences is who was not served in the program. I think they almost sorted into a group that was easier to house. And also they're present. You don't have to chase them down. They're in the hotels. I do think that makes it easier for case management. But a lot of the people who needed that sort of low barrier, they were restricted from the hotels too. So we created sort of the system where those people didn't really end up being served in the hotel model when they were in the other two models. And those are really one of the tougher groups to house because they are resistant to doing so. So not that we can't house them, but it is difficult when they don't want.
When we were operating on the hotel model, one of the challenges that the office had was as we went to go place someone in a hotel, finding out that they already were on a ban or trespass list from the property. And some of them had been formally trespassed by police, which basically, once that's done, that property owner can't really take them back. But there's not a process for that.
David touched on a question I was meaning to ask, and I might be afraid of the answer, but where were those 555 people? I think that's a good question.
I think they're wherever they were before 2023 and 24, to be honest. Like, that was really the first time we operated this. And I think some of those people probably were on the streets, but also I think some were sleeping on couches or doing whatever they did before we offered this service.
We had a lot more people that were unsheltered last year. My office directly dealt with a handful of individuals that continually came to visit the office, and we tried to be creative about whatever solutions that we could facilitate. But for some individuals, we literally found that they were restricted from every resource that we had within the system. And I think, we also would have had a higher number of unsheltered persons in our point in time count last year. And the office received more reports, either with intent to get someone service or with intent to complain about seeing someone on the street last year than we did this year. Really, if I got a complaint this year, it was about a potential issue related to the location, a concern about an increased level of traffic or litter, versus we're seeing unsheltered people that still need somewhere to go.
We did have a reduction, like a 20% reduction in unsheltered this year versus last year. Do I remember that right?
Yeah, we would have had about 23 fewer persons this year unsheltered in our count. And we know that with the count, there's always a dark figure to unsheltered homelessness.
I think it's fair. That's a fair comment, and it's likely that accounts for a percentage of the difference. But I find it hard to believe there were 500 people on the streets that year that wouldn't have been otherwise. And so I think you have to wrestle with that question. It's a difficult question, but the public is going to ask it, which is, did it fill up because it was there, or did it fill up because it was needed? And I'm only asking that as a devil's advocate, because I think you need to be able to answer that question to the citizens.
And I think we've talked about this. I do wonder, like, had we never gone back after the COVID year to a model that, like, we had the option to continue offering this service or just kind of abandoning that, because that was largely due to COVID restrictions. That's why we did it in the first place. And then we just sort of as a group decided to continue that. But what would it have looked like had we not? Like, were those people going to be unsheltered? And I don't know where they were in the first place or where they ended up going, but I do think that a sizable number of them were probably in that kind of marginally housed group during that time.
I think also, I remember prior to the winter shelter, the Salvation Army was letting people sleep in the foyer. Like, they had people everywhere. And I know that the Hope Center had people everywhere. So I think some of those people were there. They were just in shelters. Like, they were just everywhere. Like, and then Arbor had more shelter beds a few years ago. Like, I think there was just a lot more desperation and a lot more coming together to figure out where to put everybody.
That does align with, we did have meetings with new leadership at that time from Salvation Army during the 23-24 winter that were actively trying to decrease the number of overflow beds that were being operated. So I do think that is a fair point.
You mentioned that after the major winter events that we had this year, the shelter started having those weekly service events, and you mentioned a decline in the amount or the number of individuals participating in those. From the staff at the shelter or from your office's staff, are there any maybe qualitative or kind of anecdotal observations that you all made about maybe why someone living at the shelter wouldn't want to participate in a service event or wouldn't want to engage in some sort of supportive service?
Some of it's going to go back to the data around disabling conditions. Some of the folks that we're serving, we're dealing with more significant substance or mental health issues that I think were a barrier to engagement, the same way that oftentimes those are the individuals that we would need to be sending street outreach teams to go and try to address, because they're unlikely to seek out resources for themselves. And I think even though we were there on site, for some people that still wasn't necessarily going to be something that they felt comfortable seeking out. I think other things that kind of played a role, it seemed like some of the anecdotal kind of feedback from the operator was that sometimes it was just a matter of like someone wanting a specific resource right this moment. And we did see some of that just in our conversations with people. If we didn't have an immediate permanent housing resource that we could place them in, sometimes that was a major barrier to engagement. Just the fact that some of the individuals that we had more ability to house were those, for example, that had income. We know this population generally presents to us with 30% or less AMI. And so I think we did see some people that kind of just assumed they're not going to be able to help because they don't have enough permanent housing resources. Also, kind of back to that, I want this particular resource at this very moment. I had one resident very, very upset with me that I wasn't, that I did not have the DMV there on site to do driver's licenses and IDs. And I was like, I literally can't control that one. It's not a city resource. I apologize about that. We can help you with a letter that you can go to their offices. But I think sometimes it's just, you have a much higher level of ability to engage people when you're able to bring a full array of services and you have the right level of resources. I think that's just what I would say from a more non-data perspective.
Thank you.
In the interest of time, is there any other discussion on winter debrief before we vote on those items? I would be seeking a motion on Community Action Council's funding and then a motion to increase our financial assistance for move-in. Yeah.
Okay,
Yeah.
I'll do the first one for the Community Action Council.
So they are seeking an additional amount of $177,500 to bring them to an overall amount of funding of $355,000. Do we want to just restate the motion so it includes everything?
Yes, if I can remember that. I would like to make a motion to fund Community Action Council at, you said going from 177 to
355.
$355,000.
All right. Do we have a second for that?
Second.
Is that Chris? All right.
That was me.
Oh, sorry. I saw you going for your microphone, so I thought it was you when I was looking down. All right. Ron is the second on that motion. Any questions or discussion on the current motion?
Could you provide us a little bit more information about the overage? I think more families were served, but I am a little cautious about spending more than we've provided, or sending the signal that we're always going to be able to cover an overage. So I would just like a little more context to how we got here.
Yeah. Obviously, we've continued to see this trend several years, and I think it's also reflected in our point in time count data that there's just a lot more persons and families within our system at present. I also don't want to set that expectation that we'll just always have the funds to step in, and I definitely will give Marty an opportunity to speak to how they as the operator saw this. But I think we have traditionally not invested a high number of dollars in seasonal resources for families when we think about the cost that we invest in single adults. And so I think what we're kind of just seeing is a need to balance that more as we move forward and make sure that there's an adequate level of resources to begin with. And then Marty, I also invite you to share.
Sure. So I think there were a couple of factors probably that increased. I think we talked about the size of the households. I think also the weather impact, and then, well, the weather did have an impact in January, but also in terms of how the families were coming to us. I think last year it was more sort of a steady number across the winter. This year it seemed to be, we got a large number of families that came in the last couple of weeks of January. So that coupled with the size of the households made it a little more difficult, especially when you get the number of families at any given time. So like if we have 15 rooms, then that's going to be a little easier to work with than if you have 28 families at a time. That makes it a little more difficult to get them housed as quickly as, that quickly. And I will say, as far as the number goes, I think if it is the amount that you want to we want to stick at, then we probably have to do more like what the medical respite does and say we have this number of rooms, which we could do, but then you run into the dilemma of you're going to have to turn families away. And there was a lot of times that we took families, especially even some of the smaller families, because there was no other option. Like Salvation Army was full. So in terms of how we've done this over the past couple of years, we didn't have a set number of rooms because we didn't want to turn any families with children away if they had no other options. And so that's why it's difficult to hit like an exact number if we operate it in this way. But it's kind of a trade-off of whether you want to have a set number of rooms so you have a set budget, or if you want to have some flexibility so you can meet the need as it arises.
And in processing invoices, we were much closer to being on target for the original budget until January. The long length of time and the extreme temperatures, I think, made me feel as if I would rather bring that back to you all and ask for the money. And if I have to find another source for it, then the thought of a child being unsheltered in that environment.
Yeah, I do think the expense is worthy of our consideration, but I also want us to keep in mind the added expenses, and maybe we need to build in a contingency fund or something for winter shelter and the different models that we're using, so that it might not be allocated at the outset. Although I think probably, considering all expenses have gone up for the world, that we might need to be budgeting more, but that we have some kind of flexible funding in there that we know that we have set aside for that purpose in case we do find ourselves in a similar situation later.
Absolutely. So I think the motion was seconded, but we haven't voted, correct? Okay. So additional discussion? Those in favor?
Aye.
Those opposed? Definitely make a note so that we can potentially build that contingency for next year. And then since we had just a little bit more in expenses for move-in support, I would be seeking a motion to increase the winter financial assistance to, we'll say 45,000 to make it an even number that's easy to include in a motion, and we will recoup the small remainder. So I just don't want to have to say the full dollars and cents amount, but we can if you'd like to reference it in your sheet. Not to exceed 45,000.
So moved.
All right, I've got a motion from Liz and a second from Amy. Any discussion on this one? All right, all those in favor?
Aye.
All those opposed? All right, that motion passes. And we're still with me. Next item, we have, similar to a request that recently had come to us from Greenhouse 17, we had a request from Arbor Youth Services. Just some background on this. Prior to the current leadership, they had increased the transition age youth shelter, serving those 18 to 24 to 25 beds. Last spring, as Arbor worked with the fire chief and building inspection, they found that the original occupancy standard hadn't been updated since like the 70s, and it was set at 11. So they had to go ahead and reduce that capacity. They did, in working with the fire chief, identify that if they were to be able to install a fire sprinkler system, giving them a greater ability to respond to a fire, that they would be able to increase their capacity to 20 beds in the same space. They had applied for community development block grant funding through the Division of Grants and Special Programs for that. However, when factoring in Davis-Bacon wage rates and Buy America, Build America requirements and just the length of time, the new estimates came in about 112,000 over the 155,000 awarded by grants and special programs. Arbor had came to the city about trying to obtain additional funds. We do not have any additional CDBG funds that can be committed to the project. Arbor believes that they still would have an ability to cover a portion of that overage from private funds and fundraising. But they would still need some support. And talking with them, it seems like if we could cover roughly half of that difference, and we're able to propose $56,000 in funding to support the project, it would be feasible and could be executed this calendar year to restore those 9 beds and improve the overall safety response possible within the shelter. Wanted to bring that to you. You also would have an estimate to show you the work that is going to be specifically done. Happy to answer any questions that you might have. I know, again, that we don't always like to have to come to this pot of money for these things, but it's also a consideration of that we give operating dollars only to these shelters with no capital costs. And we are definitely seeing that we've had several reductions in our shelter system over the past few years. We lost the Mother Teresa shelter for veterans. We lost these beds with Arbor. I know for a portion of time, Greenhouse was reduced in the number of beds that they have. We've lost programs like Room in the Inn that used to supplement what we were able to do. So I thought it was fair to at least explore the request with you all.
I'm supportive of this expenditure, particularly because it allows for those beds to come back online for our service provider. So I'll make the motion to approve the recommended funding.
Motion from Liz and a second from Amy. Any further discussion?
I'm going to recuse myself from the vote because of my prior employment with Arbor.
It is $155,864.
Is the overage caused by Davis-Bacon and BABA?
I was told that that was definitely a factor.
I mean, the math on that says they may not need the grant, right? I mean, because if you take away the BABA and the Davis-Bacon requirement, you're going to lower the price back within budget. I'm not saying you shouldn't approve this. I'm saying you may want to have Jeff go back and do a little bit of negotiating because you may not need that full amount.
I know that there was also time between the application for CDBG and the updated estimate where some of it was going to be simply a cost of increase in materials.
Okay.
I'm happy to revisit that conversation with them and find out how much of the impact was specifically because of those requirements. But I know that those were at least factors.
So in this, there were 25 beds at one point, and it was reduced, and this would get us get them back to 20 beds.
Yeah.
So what about the other 5? Or is there potential for those 5 more?
Not at this time. They would have the capacity to do overflow, but we would not attempt to, on a nightly basis, add back the additional 5 beds just based on the guidance from the fire chief about what they could safely do on an average night.
Okay.
Based on Commissioner Lanter's remarks, I would be willing to amend the motion to say up to $56,000, pending further discussion with Arbor Youth.
All right. Any discussion on the amended motion? All right. All those in favor? All those opposed? All right, that motion would pass as well. Final item for me. Continuum of care update. So David had kind of touched on this in his report out for the advocacy committee, but we just going to share again with the whole group that's here today. We have gotten confirmation via a recent email from the SNAP's office that the fiscal year 26 Continuum of Care Program NOFO is anticipated to be released by June 1st, and that they intend to announce awards by December. So to give a little bit of context, normally we would see a NOFO released around July, with the due date in the fall, and awards sometime between late January into February. So we are likely to see a kind of short competition based on the contents of the attempted 25 NOFO that a court injunction blocked HUD from moving forward with. We want to just remind providers of some things that we anticipate when that NOFO is released. We do still anticipate that there's going to be a general desire from HUD to move the COC program away from permanent housing, and that could be a limit on how much funding we could use for permanent housing projects like rapid rehousing and permanent supportive housing. It also could be in the form of imposing length of rental assistance limits to a maximum of 2 years for all individuals and households. We also anticipate that there's going to be additional requirements for transitional housing providers, like 40 hours of individualized service per individual, as well as work requirements for those in housing programs. So right now we are taking meetings. We've already done several this week with returning providers or recipients of this funding or prospective, so that we can go ahead and have some open conversations to talk through ideals about how an existing program might pivot to address some of these requirements that we anticipate, or how we might design new programs that might be a good supplement to this. We haven't yet been told what a permanent housing cap might look like this year, but there is still a lot of language that suggests an increasing emphasis on transitional housing and supportive service only programs. So we definitely encourage any of our members that would have an interest in potentially applying to schedule some time with us to discuss. You can also anticipate that upon the release of the NOFO, we will offer a webinar to kind of review some of the details of what's in that NOFO to make sure that our applicants have good knowledge. And then we will have some opportunities for technical assistance. Once we officially open our competition, we will have to keep our guidance to more technical answers, but we are happy to work with any of our existing providers or new applicants to make sure that they have the tools if they want to pursue an application. So we really just kind of wanted to set the expectation so that the board members kind of have a timeline and can anticipate that we are probably going to have some meetings that we might have to call depending on the benchmarks. Part of our initial review is going to be quickly getting to the board members any sense of if we might have to call a special meeting and establishing those dates so that everybody can save that on their calendars. I know we hate to do special meetings and ask more of our board, But sometimes the way that this is released and some of the timelines that we have to hit in terms of when we open, close the application, announce awards, sometimes facilitates that. And I feel best about giving you a heads up on that. Any questions right now about the Continuum of Care program? All right, then our next regular meeting is going to be here in this space on July 8th.
We have one more item on our agenda for other issues and public sharing for issues not on the agenda. While you're thinking about what you might share, I'm going to say, please go vote. Early voting starts tomorrow. Your vote is important. You can vote at any Fayette County Library tomorrow, Friday, and Saturday. It's no excuse early voting, so anyone can do it. And then on Tuesday, on Election Day, you can vote at your precinct or at the library. So please, please, and bring a friend. Any other comments or announcements? Yes. Bring 5 friends. Okay, I'm not seeing anyone jump in with other announcements. Thank you all. We are at the end of our agenda, so I'm going to adjourn our meeting.